Okay, I may or may not watch Sister Wives, and I may or may not have watched it last night. And I may or may not have heard not one but two people on that show say that during a cesarean section, we cut through the abdominal muscles. I just want everyone to know that cutting through the abdominal muscles is not a routine step during a cesarean section. It's just not. Now, this is the two bellies of the abdominis rectus muscles, and then you see that little line down the middle? That's called the linea alba. In pregnancy, as the belly gets bigger, that area can separate. This is what's called a diastasis recti, okay? Now, that doesn't happen in everybody, and as a matter of fact, in most cases, when I do a cesarean section, the abdominal muscles are still together. In some cases, when I do the cesarean section, there is that space there. But regardless, we enter in between the muscles in both cases, and we push the bellies of the muscles apart. We do not cut either belly of those muscles. And another important thing, and a lot of times I hear it on social media, is that the diastasis recti is always because of the separation there. That's not always the case. These bellies of the muscle can also stretch. So there may not be as big of a space in between, but because those muscles are not strong, the bellies themselves can widen and also cause it to look like there's a diastasis. So it's that pooch that you might see or that separation you might see after you deliver when you're trying to do a setup is not always because of this. It could also be because these rectus muscles, the two bellies, are also stretched out. So it can be from either cause, not always this. So I just want to make sure everybody knows we don't cut the muscles. Have I before? Yes, but that's only in severe cases of what we call cement or really bad scar tissue, and that's unpredictable. Sometimes it happens, but what we try to do is repair it to the best that we can to allow those bellies of the muscles to come back together, and we try not to ever cut them all the way across on either side. We just cut the amount that we need to if we absolutely have to. Okay, just got this comment on my video about the rectus abdominis muscles in a C-section. They do take out organs to get to the uterus. No, we don't. We don't take out organs to get to the uterus. Promise. As we go through the layers of the uterine wall, there's 7 layers actually. The uterus is right there. No other organs in front of it. Just the uterus. So very easy to get to. Now, this is the top of the uterus, and the intestines can be pushed up high as the uterus gets bigger. And sometimes those intestines, as we're doing what we need to do on the uterus, can kind of pooch out, and we just push them back in. Now, once the baby is delivered and the uterus starts to contract down, we can reach in and pull the very top of the uterus, which the uterus is much smaller by that time. It's at about the size of, about the height of the belly button, and pull it out. It's called exteriorizing the uterus, and to repair the uterus and tie tubes or whatever else we need to do. Or the uterus can be sewed in situ, meaning while it's still in the abdomen without exteriorizing it. But we do not take out any organs to get to the uterus. I promise. Okay, was curious how McKelty from Sister Wives was released after one night after having had her cesarean section. I always spent 3 to 4 nights minimum recovering. So I'll just tell you how we do it where I work. And this is in patients who are otherwise uncomplicated, baby's doing well. Minimum time after C-section is 24 hours. But everyone is entitled to stay until post-op day 2. The day of surgery is post-op day 0. The next day, post-op day 1. The next day, post-op day 2. After 24 hours on post-op day 1, if the patient's doing well, meeting milestones, and the baby's doing well from the pediatric standpoint, they can go home. Or they can stay until that second day. It's up to them. Again, in patients who are otherwise uncomplicated. I will say about probably close to 2/3 of patients want to go home on post-op day 1 when given the choice. They do. So we allow that as long as they're meeting milestones and the baby's okay. But if they want to stay that second day, they can do that too.